Tomorrow, the temperature is expected to fall 25 degrees below zero. It is going to be a very cold day, and the night will be even colder. There are various organizations in Barrie, such as Busby Centre, Salvation Army, Barrie Shelter, and Ryan's Hope, among others, helping and protecting vulnerable people during the extreme weather. I talked to Christine Nayler of Ryan's Hope. She and her husband started the organization in the memory of their son, Ryan. He lived with bipolar disorder and had to use drugs to cope with it, as he did not receive enough support from the Canadian healthcare system. He tried up toxic drug poisoning. Even though Ryan was struggling, he was helping others. His house had become a supervised consumption site. His slogan was, "Nobody dies under my watch." Ryan's Hope is continuing Ryan's unfulfilled work. It provides free sleeping bags and hot paws to help homeless people stay warm. Christine also educates the media, general public, and even police about drug crisis and how to interact with people using drugs. She doesn't want us to use terms like addicts and rather see a person behind it. Thank you so much for your time. It's a pleasure, and I wanted to talk about a few things since you talked to Sam uh,
Hmm.
last year, and one of the things you advocated in during your discussion with Sam was the supervised the safe consumption site. You
Hmm.
were a strong proponent of that site, and that has been approved by the city council. The proposal is right now with uh, the province of Ontario, but there has been some delay. Doug Downey, he's asking on his website for people, to give their feedback one more time. So, and during the council meetings, some of the councillor, including Keenan Alvin, said, the urgency of, approval of this site. So, what do you feel about, the entire, the process that has been going on in terms of approval, and now it's kind of stuck there.
I think it's ridiculous how long it's taken and that we still don't have it up and running. It is like an emergency. It's a national emergency, the toxic drug crisis, and people are dying every day. We're losing people in our community every week to toxic drug poisonings, and there's no reason to continue to delay it. There was so much consultation with the community that happened, and everybody that wanted to have their voice heard was given an opportunity to have their voice heard. So having, somebody now say like we people didn't get the proper amount of time to be able to voice their concerns, and trying to delay that process even further is very concerning because people's lives are on the line right now, so it's really frustrating for me.
But what do you think are the reasons behind the opposition to the site? Well, because it's
uh,
yeah. Go ahead.
it's stigma. I mean, that's what it all comes down to. People have this idea of what drug users are, and they have this idea that they're dangerous people, and they don't want them in their neighborhood. They don't want them around their children. They're afraid it's going to bring crime to the area, and it's going to lower the values of their properties and stuff like that, which is not true. And I mean, drug use is happening in Barrie already. It's just not happening in a safe environment for people. And actually, in cities and communities where they do have supervised consumption site, it actually lowers crime rate, and it actually has benefits for the community because people are have a safe place to go rather than having to hide in alleys and stuff like that. So the chance of having to like come across somebody when you're walking down the street going shopping and stuff like that is going to be lessened by having a safe place where people can know they can go. And actually, it's not like people are going there, they're getting free drugs to use drugs. They have to bring their own, the substance that they're going to use. And it's an opportunity for connection. It's an opportunity for people to know that they're cared for, that their community cares about them. It's a medical facility, just like, going to a doctor's office or any other type of medical building that you would go to. And there are, services that will be on site that they'll be able to connect with. So actually people that, are going to a supervised consumption site, they are going to have opportunities to connect with services that can help them.
Do you feel sometimes that, the delay in the process or asking people for, feedback one more time is going towards, how to make sure that the site doesn't come into existence? Is that what you feel when, this
Yeah,
can?
I think so. I think that's what the purpose is. They're trying to stop the site from actually opening up. And it's very upsetting that we have to go through all of this process to have this. We don't go through this process for any other type of medical facility. It doesn't have to go through city council approval. It doesn't have to go through all these neighborhood consultations and community consultations to see if we could, have a lab opened up, or, an x-rays, any other type of medical, treatment facility open up. So why do we have to do it for this? It comes down to stigma, and that we value certain people less than other people.
When it comes to, your own experience and, your son's experience, so how do you think, in particular this, supervised consumption sites helped him, maybe, or his friends, or, how the sites, if there had been more sites, how that would have helped?
So actually, the supervised consumption site probably wouldn't have helped my son, but that doesn't mean that I wouldn't advocate for it to help other people, because he wasn't an intravenous drug user. So that's not how he consumed his drugs. He inhaled his drugs through smoking. And currently with the site application that we have in, that's not part of the plans for there to be an inhalation room for people to be able to consume drugs that way. So that is something that I am still concerned about, and that I have advocated for, is that needs to be a part of the plan for supervised consumption sites going forward, because the statistics are showing that, I don't have the numbers right in front of me right now, sorry, but that more people are consuming drugs through inhalation. And so those people still need to be cared for. They still need a safe place to be able to consume their drugs, and have people there that would be able to respond in the event that they receive drugs that were toxic, right? So, but that doesn't mean that we shouldn't take this first step, because this is a first step and it's going to help a lot of people. And I think that's important. And just having that in the community allows people to know that this is a community that does care about people that use drugs. And so it reduces a little bit of the stigma. And when the community sees that, okay, this hasn't actually increased crime, it hasn't actually made our neighborhood into this horrible place to live, then it's people are going to maybe have their minds opened a little bit, and then we can take further steps to bring people into community, and to help them to meet them where they're at, and help them with whatever next steps are going to work for them.
I spoke to Dr. Lisa Simon of the Simcoe Muskoka District Health Unit, and they were also part of the process trying to get this site approved. So at this point, as there are again doubts and a possibility of being delayed, is there anything being done from your organization or other organization in terms of reaching out to people, trying to convince them about this particular site?
So I think that like most of the consultation, process was very thorough and stuff like that. I think that the people that wanted to actually learn the facts and really learn about the issue have learned and continue to learn. I'm a member of several different organizations that do a lot of advocacy work and awareness and stuff like that. So we continue to have the conversation. We continue to speak to media when we can and to share information about the issues facing people that use substances in our community and in our country. And I think that's important, that the conversation needs to be ongoing, not just necessarily about the site and the location of one site, but the whole overall issue, because it's a greater issue, right? It's a national health crisis, and we need to be responding to it like nationally, like all levels of government need to be involved. And there's several things that we need to be taking steps forward on, right? Like safe supply is really key to addressing the toxic drug crisis, because the whole drug supply now is toxic and people don't know what they're getting. And so I think that is an important thing, is the language, and making sure that we are using language that's appropriate for the times that we're living in. And so when I talk about my son's passing, I say that he passed of a toxic drug poisoning rather than overdose. And I feel that that language really, really matters, because overdose would mean that he knew the dose of the drug that he was taking, and he knew what drug he was taking, and he chose to take too much, which is not the case. My son was not an opioid user. He used methamphetamines, and but the whole drug supply is toxic. So regardless of what people are taking, stimulants are just as dangerous, and they're just as toxic now. Well, because they're mixed. Everything is mixed. People don't know what they're getting. Fentanyl is dangerous. Benzodiazepines is being mixed in with a lot of the drugs that people are getting on the street too. And so I am a huge advocate for safe supply.
Yeah, and these are the two things I wanted to talk about. First is about the drug supply, and the second is about the narrative in the media or general public. So first about the contamination of the supply. And because we, for example, if there is contamination in the water or food, there is a way to deal with it, because we consider those as necessities, and people should get clean water, safe food. So is that what you are talking about when is that what you're asking, like maybe government should step in and make sure these people get because that's where this get very complicated, because people think drug use, people really already have stigma about drug usage. They don't treat these people equally, and if there is a contamination, people think these people are already doing a bad thing, so it doesn't matter if those are contaminated, and what happens to them. So how do you think this problem should be dealt?
So definitely safe supply, and that it is at a national level, right? Like that we need to make changes federally, and have a safe supply of all drugs for all Canadians that use substances. And we already have safe supply of certain drugs. Back when they had prohibition of alcohol, people were just making illegally, and people were dying from that, and the criminals were the ones that were in control of it back then, and there was a lot of crime and that connected to that. But when you take it out of the hands of the criminal, because if it's illegal, then they're the ones in charge of the supply. If the government is in charge of the supply, like people use different types of drugs to cope with life is hard, and there's multiple reasons why people use drugs. If your drug of choice is alcohol, you have an option to have a safe supply of your drug. You can go and you can purchase it from the store and you know exactly what you're getting. And the same now with cannabis. The government did, change laws and stuff like that. And now people can go to the store and they can get cannabis if that is their drug of choice. Why are we still like saying that if this is your drug of choice, you don't have a right to be safe? All Canadians should have an equal right to safety and to be able to get the drugs that they need. It's a medical issue. People use drugs. My son used drugs to cope with his mental illness, and he self-medicated because the pharmaceutical medications that he was using did not work for him. The ones that worked for him mentally, they had physical side effects and he wasn't able to stay on them. And so his doctor had to take him off of those ones. And so he found a drug that worked for him, but unfortunately, he was denied access to a safe supply of that drug. And so he had to get it in a risky way, and it ultimately cost him his life. And that's what's happening, across our country. And we are losing too many people, and it's preventable. And it angers me that the government knows this and they refuse to act on it. And it is because of stigma and it's because of politics. They want to get reelected and it's a hot button, topic. And they don't want to, make people upset that they're kind of condoning criminal, activity or certain like type of people. But, everybody uses drugs, and the people that no one is immune to this. It's not just a certain type of person using drugs in back alleys and stuff like that. It could be your brother, your sister, your son, your daughter, mother, father, best friend, cousin. Like it, every week I'm meeting new people that have been touched by this supply, that thought that this would never happen in their family, that this would never happen to somebody that they knew. It did. And we have a responsibility to all Canadians.
Yeah, I'm sure you are aware about the Portugal did decriminalization of all drugs for personal use way back in 2001, and it's been more than 20 years. They had a positive results of that, but despite of that, really no country has really taken that steps. Is that a model that you think Canada should follow?
I think, yeah, it's proven successful. And what our government is doing is these little pilot projects, right, to see if giving people access to a safe supply is actually going to work, and it's actually going to keep them safe, and it's going to improve their life conditions. And all the pilot projects that they've had, are successful. But I mean, this is a national emergency. We need to stop with the pilot projects, and we need to act now, because the drug supply is getting more deadly, like weekly, and we are losing so many people, and these deaths are preventable. And we've proven that we can act in a national emergency, that governments can come together, and we have the resources to be able to address an issue like a pandemic like COVID. But this is an issue that needs to be addressed too. And that's why I continue to speak up about it and share Ryan's story, because I really feel that the only way we're going to get people to pressure the government to make change is by humanizing it. These are not just numbers. These are not just statistics. These are real people. These were members of people's family. They had lives. They were human beings, and they were beautiful people. And their life, their loss, it affects a whole community. So we need to talk about that. We need to talk about it like the human issue that it is, because it is a human issue, and we can prevent it. And government and inaction is continuing to allow people to die every day in our country, and that's unacceptable.
And another thing I wanted to talk about, the general use of words, when it comes to drug use, or who the people who use drugs, both by general public as well as media. So could you talk a little bit about, you briefly mentioned that, but what about when somebody is using drugs, and how they should be referred, and somebody dies of drug use, what are the different conditions or circumstances under which that can happen?
Sure. I feel that language really matters, and it has a huge impact in how people that use drugs are treated in the community while they're alive. Number one, and either will help them to get the medical treatment and the supports that they need, or it will push them into hiding their drug use and their issues because of fear and stigma. And I feel that that happens far too often. I know that it happened with my son for, all the years that we were advocating for him to get the supports in the community that he needed. And it's sad to say, but it was actually the medical community, the medical professionals that were supposed to be able to help him, that actually gave the most stigma. And to me, that's unacceptable too. Like when we first tried to get him help when he came back from Edmonton, and we knew that something was going on because he was already self-medicating. At that time, alcohol was his drug of choice. Whenever we took him to the hospital, they would just, dismiss him, and they wouldn't even listen to our concerns or his concerns about what was going on in his mind, because they're just like, he's just a drunk, he's just an addict, and getting help for somebody is virtually impossible. And so many people that I've met in the community through Ryan and through the work that we do now through Ryan's Hope, they won't even go to the hospital. They've given up on that there is help for them because of how they've been treated by the medical community, because of the stigma. They go to the hospital, and immediately, it doesn't matter what they're going for, if it's a mental health crisis, if it's a physical issue, because a lot of these people live on the streets, and there are a lot of like health issues related to living unsheltered and stuff like that can become deadly very fast. And they go to the hospital, and they're just like labeled as drug seeking, and their concerns or their medical condition is not even addressed, and they're like, get them out of the hospital as quick as you can, right? And that's not okay. So language does matter, and I feel that the professionals that I think that they need maybe a little bit of training, and they need to update the language that they're using, and have some sensitivity and awareness that this is a health issue and it's a medical issue, and they're there to help everybody, right? Not, we can't separate mental health from physical health. It's all connected, and I think that's so important. And then in the community too, when we're just talking about people like they're addicts and stuff like that, like small things like using person-centered language, person first language, right? Like a person who uses drugs or a person who consumes substances makes a big difference, because we're putting the person first, and that's just an issue that they're dealing with at this time, right?
7-8 years back, when we were living in Boston, and I took my wife to emergency hospital, Mass General Hospital, and there was a woman who was there, and she came in for emergency, and she was asking for some prescription for some drugs that she wanted to use. She was using some drugs herself, and there was kind of argument was going on, and that at that time I didn't know much about this issue, and there was argument going on back and forth between the doctor and that woman. And they said, no, we can't prescribe you this. She said, I want, I have this condition and that condition. And ultimately they did not, they turned her back. And at that time I was on the same boat, that I was just thinking that she's an addict and she just wants some prescription drugs so she can go home and use. And of course I was ignorant at that time. But as you said, even the doctors, they responded very differently. And they did not entertain her, or maybe sat down with her, or there was nobody there to speak to her about those issues. So she was just treated as somebody who came in to get a drug, and once she gets that, she can go home and use that. So I think that's both about medical professional as well as general people like myself. And recently, this last week, CTV did a story about how Ryan's Hope is helping homeless people with food, warm clothes, and blanket, etc. So we have seen the temperature drop down drastically, went into negative. At the same time, there has been a crisis when it comes to affordable housing. So I remember when you talked to Sam last time, you mentioned about how your son was helping other homeless people, in his apartment, or whatever way he could, because he was using the drugs, and he knew what challenges other people feel. So just trying to understand, two-part question is what work specifically your organization has been doing on this different front.
So yeah, we have been advocating obviously for more options for people that are unsheltered and living outside, to be able to come inside. So last February, we had been made aware of the issue that was going on with the warming center at the bus terminal, and so we felt like we need to advocate for a better option for people that are unsheltered to be able to come inside. And yes, we have shelters in our community, and they do great work, and I support the work that they do. And like Busby Centre was a huge support for Ryan during the last few years of his life. Unfortunately, like, he mostly went to the drop-in center. It was a place where he felt welcomed in that, because he was house. But he wouldn't be able to function in the shelter system model because of his mental illness. And there is a lot of people that, due to mental illness or trauma or substance use issues, are not able to function within that shelter system model. But they're still human beings, and we still have extreme cold temperatures in Canada, and we need to have another option for them. The narrative that goes on a lot in the community and in the media is that the people are choosing to live outside because they don't want to go to the shelter, because they don't want to follow rules. And I challenge that, because it's not that they're choosing, it's that they can't function within those limitations due to their mental illness, trauma, substance use issues. That's not a choice. And the only other option is outside, or go here where you can't function, and you'll either be asked to leave or you'll leave on your own. Right. And for my son, just giving an example, he lived with bipolar disorder. So if he was manic, he wouldn't be able to sleep for 5 days straight. And he would have so much energy, he would have to pace, and he would smoke like a pack of cigarettes in an hour and stuff like that. If you're in a shelter and you're not allowed to leave your room, and you have to sit on your bed quietly because your roommate is sleeping and you can't sleep, like, that's too hard for people. They need to walk, and there's lots of multiple issues that has nothing to do with not, like, choosing to follow rules. And so that's an option. We need a safe place for them to be able to go, that's outside of the shelter system. where it's more low barrier for them. There's other reasons that people choose not to go into the shelter system, which has to do with being able to stay together as a couple because we have no shelters for couples, or they have a pet. There's so many different reasons. And a lot of organizations came together and there was a lot of community conversations. And so I think that people are starting to become aware of it, that yes, the shelter system is great, but it's not a one size fits all solution for everybody that is unsheltered. And we are seeing more people come into homelessness now because of the housing crisis we're facing in Barrie and across the country, and also because of the job situation and where we are at right now with the pandemic and people losing jobs and not being able to get housing. And so we do need to have more options for people. Obviously, housing is the number one issue that we want, but affordable housing is not affordable for everybody. And we need more options for housing. Like we need supportive housing. We need rent geared to income. So it's an ongoing conversation. It's a bigger issue that we need to talk about. But in the meantime, we need to at least provide for the basic needs of these people in extreme weather conditions that we face. And so we need to have a safe place for them to go in the winter to get out of the cold. And obviously in the summer, it's going to be an issue with where do they go to get out of the heat. And something that I've learned so much over the last 8 years since Ryan got sick, and so even in the last year doing the advocacy work that I've been doing, I learned that people are more at risk of dying due to heat when they're experiencing homelessness than cold, which makes sense because you can hide from the cold. You can't hide from the heat. You can't get out of it, right? And so we need to be having ongoing conversations about, okay, what are the options going to be for the summer when we get the extreme heat? Where will people go?
Yeah, that's interesting. I did not know about, you know, that, interesting part that we can't, we can't escape heat. And, I come from India where, it's a lot hotter than, it gets colder. And the next question it's more personal. So, it's, you can decide not to answer the question, but when you go out, when you are trying to help these people, whether it's at night. So how do you deal with this personally? Because as a mother, you have seen your son, deal with this issue. And for many of the people, and I'm not blaming them, but the family members, that this is so hard. The loss, to deal with this loss is so hard that they don't want to confront it. They don't want to deal with this issue any further. They don't want to deal with people or interact with people who are using using drugs. So how is it personally for you to go out and help those people, and knowing that your son was at that place at some point of their lives? How does that emotionally affect you, and how do you manage that?
So yeah, it's really, really hard. And some days I feel like I'm not going to do it the next day because it's really hard when you're dealing with the realities of what people are facing living on the streets, and it's heartbreaking. And I go home and I cry and I pray, and I think my faith really helps a lot. So that's what gives me the strength. And I do feel like Ryan is still here with me in a different way, in a different level, and he's been sharing his strength with me and guiding us on our journey through Ryan's hope. And I know a lot of people might think that's crazy, but I feel him with me. And I know he's sharing his strength with me because even when he was still struggling, he was still helping other people. Like his house was a supervised consumption site. And he had a slogan that nobody dies on his watch. And he always made sure that he had naloxone there and that his friends knew that it was a safe place where they could come and they could use. Or even one of his friends said to me, like, some people would maybe say, like, Ryan's, what, it's a drug house. It wasn't. That's not even true. Like half the time there was never even, it was a safe harbor for people. People knew that if they had nowhere to go, they could come to Ryan's house and his door would be open. And so we try to be a safe harbor for people. Not that we can bring people home. I can't do that. I wish I could. Some days I'm like, I just want to bring them all home with me, but I know that I can't do that. And we have to set boundaries. And it's hard to set boundaries because people need so much. And every time I leave them, I'm like, I don't know if I'm going to see them tomorrow. They might not make it through the night because of the extreme cold, and there is no option for them to get inside. And so we give them what we can, like 3 sleeping bags and hot paws and like give them, whatever we can to try to help them stay warm. And then with the drugs and using the substances alone, at night in the extreme cold, it's more of a risk for people. So that's more dangerous in the winter and the extreme cold temperatures as well. It's really hard, but I feel that doing this work is actually what's keeping me going. And that's why my husband and I started it in the first place. Because we felt like the first few weeks after Ryan's death, we just lied in bed and cried, and both of us were being swallowed up by our grief and our depression and the helplessness. And so this way, at least we feel we're making a difference. I want to share this story with you. It's my story that one of my favorite stories, and I go to it when I feel like, oh my gosh, this is just too big. We're not doing anything. It's the starfish story, and I don't know if you know about it.
No, I
There was this man that went out early one morning for a walk on the beach, and he saw this little boy that was walking along the beach, and he would bend down and he'd pick a starfish up and he kept throwing them back into the ocean. And he was doing this for like an hour, and the old man was watching him. And finally the old man went up to the little boy and said, I can't help but I've been watching you, and I'm wondering why you're doing that. And the little boy said, well, each night, like the tide goes in and comes in, and all the starfish get washed ashore, and then the tide goes out, and the sun's going to be coming up in an hour, and then they're all going to die. And I'm just helping them. And the old man said, well, there's thousands of miles of shore, you can't possibly make a difference. And the little boy paused for a moment. He looked at the man, and then he bent down and he picked a starfish up and he threw it back into the ocean. And he turned around and he said to the old man, I made a difference to that one. And so that's my thing. Like, yes, this is a huge issue, and I cannot solve the toxic drug crisis or homelessness or mental illness on my own. But if I make a difference to one life, and every night that we go out, every breakfast that we serve, we've made a difference to at least one person. And so that's what keeps me going. And we all can make a difference in one life.
yeah, that is definitely a beautiful story. Yeah, so that's all I wanted to talk about. Is there anything you want to say to the people who are in charge, maybe decision maker, politicians, or general public about this whole crisis, the change that you would like to see sooner than later?
Well, we need to stop the stigma. We need to start seeing this as a human issue, rather than like a moral failing. It's a health issue. And it's a conversation I've been having with a lot of people last week, with everything that was going on at a county level, city level, that's going on at a federal level, that I feel that anybody that's in a position of power to make choices about people that are unsheltered should have to come out on the street and actually talk to the people that are unsheltered and see the realities of living on the street before they get to make these decisions. That's just what I feel, because they don't have a clue. They're not on the street. And even talking to me or talking to another frontline worker, it's not the same as talking to somebody that has to spend a whole night out on the street wondering if they're going to like freeze to death. And the decisions that I've heard people have had to make over the last 3 weeks because of the extreme cold temperatures we've had are heartbreaking, and nobody should have to make those decisions, and the people that are in power, they need to understand like the consequences of the decisions that they make. And their decisions, when they're making those decisions, I feel they're all made based on finances and how much money we're willing to spend on this issue, and on public opinion and what the people that are actually going to get out and vote are going to think about this issue. And that needs to stop, because they're responsible to every resident of their city, or every person in their country, that they're elected to represent all the people, not just the ones that are going to go out and vote for them.
That makes sense. Yeah, that's all I'll have. But thank you so much, Christine, for taking the time talking to me, and the work you have been doing. I wish you good luck with all your work. Thank you so much.
Thank you so much for giving me an opportunity to speak and share.
Yeah,
Thanks.
thank you so much.
Okay.
Okay.
All right. Bye.